it's important to understand the Health Care Reform Affordable Care Act and how it's going to affect us. Now, the Affordable Care Act claims that it's not going to cost any more money, and yet we've got 30 million new people that are going to be added to Medicaid or Medi-Cal. So how is this going to work according to this new analysis of data?
I think it's a lot of dreaming and it's a lot of politics. How could you possibly put 30 million more people in to a healthcare system
And keep the
that's
same
already
amount of
overburdened,
doctors?
have the same number of doctors, and pay them more money, which they're also saying? It just doesn't make any sense. I think the idea is they're trying to recoup some of the money that's been wasted in medicine, or some of the fraud that occurs that occurs with billing. But this amount of money is ludicrous to try and save. So I don't see it happening, Vicki. Medicare rates are the Medicare program is being cut by 2% of its services a year, and it will continue to do that for 10 years, which means that over that period of time there'll be 20% less in the way of services. And when you look at the Medicaid system, particularly in California or New Jersey, where the reimbursement rates are really low, it's a terrible system.
Well, a lot of the people in California, anyway, that want to be seen, they have to pay out of pocket.
Well, if they want to see a good doctor, the best doctors, that's true. I mean, what kind of a doctor is going to be able to work for a very low rate? I mean, not many, because the problem is that overhead is often $200 or $300 an hour, and if you're getting back maybe $150 an hour, you can't do it. Unless you start streamlining things so it becomes a mill, it's not going to be possible to do. So we can't depend on the healthcare system as it's run in either New Jersey or California to be successful with the Affordable Health Care Act changes.
Do you know how this is going to work with HMOs?
Well, I don't know what they're going to do, but in general, HMOs are in the ballpark of Medicare in terms of reimbursement. And that's why maybe a third of American doctors won't accept Medicaid patients, but maybe half of that, 17 or 18%, won't accept either Medicare or certain HMO programs. I know I can't do that and keep my office going because it costs me about $300 plus an hour to be able to provide the services that I do for my patients. So when I would get up in the middle of the night years ago and go see a patient who was on Medi-Cal and for some reason get something like $5 for that visit and have spent an hour there because of glitches and rules that I didn't understand or my office didn't understand, it just gets to a place where you can't do it, even though these are the people who really need health care.
So what about this pay hike to match Medicare for the doctors?
Well, that's part of the Affordable Care Act, which means that there's going to be an increase in payment for Medicaid services. And today in some states, it's already a pretty good deal, Vicki. You go to a state like Wyoming where they get 150% of what the Medicare rate is, which means they get 50% more than what the standard Medicare rate is.
I wonder how they can afford that, though.
Well, they don't have that many patients. They want to do good, and they can afford it, so they do it. In California and New Jersey, far different story. And in general, what happens? We're looking at the Medicaid to Medicare fee ratio of being 74%, which means if you bill $100 for a service in Medicare, you can bill for the same service in Medicaid or Medi-Cal, and you'll only get $74. So there are lots of problems here, and it depends on which state you're from, what kind of reimbursements they do in terms of what doctors are going to get. But in terms of the whole system itself, it's ludicrous to think that you can put in a whole bunch of 30 million new people, pay doctors more, which is what's going to happen according to the Affordable Care Act in the year 2013 and 14. There's going to be a dramatic shift here and lots of problems. So,
well, they even did in this survey how many doctors' offices reject patients that are Medicaid.
Oh, exactly. That's why a third of the people as a national average, a third of doctors won't take Medicaid patients. And in states like New Jersey and California, very few do because you can't afford to do it.
So healthcare is a business; it's not a service, and
so much. That's right. I mean, there's
some of the Affordable Care Act is good, but a lot of it's just filled with
dreams,
garbage, and lies and dreams.
Yeah. So we have to take a careful look at that and start taking more responsibility ourselves for how we deliver health care. I think we need to move more into a direction that we're seeing other countries do with universal health care.
Remember years ago we talked about how it would be helpful for people to have like a savings account of their own that was their own healthcare savings account.
Yeah,
It's
those
too
are still
bad
legal.
that didn't really catch on.
Oh,
for
it
people to
did
do
for a lot of
that.
people. For people who have good insurance from good companies, okay, from bosses, okay, or companies that hire them that have good health care plans, a lot of services are now being included that lets you pick the service that you want. But that's a mile away when we're looking at Medicare or looking at things like Medicaid or Medi-Cal. So we need to start thinking about what we're doing here and start creating a plan of universal health care that gives doctors flexibility to practice the medicine that patients need.